Welcome back. Well, when we meet someone new, there are a few things in life that open our hearts more instantly than a person with a beautiful smile. But what about your own smile or those of your children? Do you think doors or maybe advantages are being closed to them for simple cosmetic reasons with your smile? Well, joining us today is Dr. Terrence Major from the offices of Chattanooga Dental Care. He's going to talk to us about some procedures and ways to help us change our smile and feel a little bit prettier. Thanks for joining us, Dr. Major.
Well, thank you for having me.
Okay, so your offices obviously do a vast array of dental care, but today we want to focus on sedation, dentistry, and dental implants.
Yes.
Which one do you want to start talking about first?
Well, let's start with dental implants.
Okay.
The purpose of a dental implant is to replace missing teeth or to replace loose dentures with something that's much more stable.
Right.
So people who have dentures, some people wear them very comfortably, and other people struggle with them because dentures, especially the lower one, constantly moves. So with dental implants, we can stabilize that denture so that someone can chew more effectively and smile and talk more confidently.
Yes, in many ways, it'll change their smile. They'll be more willing to smile, and even speaking, they'll feel more confident.
Absolutely. I see so many people every week that have dentures and are struggling with them, and this is a very nice addition.
Now, you brought us a model to kind of
Yes.
show us the difference between the stabilizing difference, I should
Yes.
say, with dental implants
Yes.
versus non.
A conventional denture.
Okay, so talk me through this.
This is a implant denture. Most dentures look just like this and just sit on the gum. So every time the patient lifts their tongue or tightens their lips, the denture will actually move. So patients who don't have implants have to learn to manipulate the denture to keep it in place. Now with dental implants, we can actually make it snap into place. So the denture snaps in and it just
That's a snug
doesn't
fit,
move. It
right.
is very, very snug. And there's different ways. Some people do 2 implants, some people do 4. We also have a method of putting a full arch of teeth in that are actually screwed into the implant so they don't come out at all. So there's lots of choices based on what that patient's needs and wants are.
Perfect. And now talk to me a little bit more about sedation dentistry. And number one, what is it? I mean, it sounds pretty simple, but sometimes it's not. And then who are we talking about specifically as an ideal candidate for that?
Anyone who is nervous about having dental care or is having major dental care and wants to be more relaxed during the visit, sedation is an excellent chance for them to be more comfortable.
And it's safe, though, right? A lot of people get scared about being sedated, but it's perfectly safe.
Yeah, we're actually doing what's called conscious sedation. So it's a very safe level of sedation. Patients are still conscious. They'll feel very drowsy. They typically have very little memory of the visit, and they're breathing on their own, they're swallowing on their own. They have to respond to us when we ask them questions. But the whole idea is to get them relaxed so that they can get through the procedure much more easily.
A lot of people have fears about having dental work done, and even some people with cleanings. Now, is this something that's available for just adults, or do some children fall into this category?
Oh, many children fall into this category. I don't sedate children. I have a pediatric dentist or pediatric dentist that I refer to for children. I only see adults for sedation.
Okay, so someone is interested in sedation dentistry or maybe has a few more questions about dental implants. What's the best process to learn more information?
Well, first you can go to our website, and there's several videos and descriptions of the different procedures that we do. Also, you can always look at the American Dental Association website. That is a very good place for all sorts of information. So those are great places to go.
Do you do consultations with new patients?
We absolutely do, and if it looks like you need our services, then we'll be happy to have a consultation, an exam, and talk about what the pros and cons of sedation dentistry and implant dentistry.
You'll help me find what I need, right?
Absolutely.
Well, Dr. Majors, what's the best way for someone to get a hold of you?
Well, they can call our office or they can text our office, and the number is 423-499-9300.
All right. Well, thanks so much for joining us and telling us a little bit more about sedation dentistry and dental implants. If I had dentures, I would be wanting that fit, that's for sure.
Yes.
Thanks for joining us.
You're very welcome. Thank you.
We'll be right back.